Hello everyone, today I'm going to be talking about the yellow fever disease, which is the first human virus discovered. In my presentation, I'll be talking about the disease, the medical importance, history, geographical distribution, causative agent, causes, transmission, life cycle, diagnosis, treatment, and prevention. Yellow fever is an acute viral disease commonly known as yellow jack or yellow plague. The disease is caused by the yellow fever virus and is spread through the bite of an infected female mosquito. It infects humans, some mammals, and a few other species of mosquitoes. It is commonly found in tropical and subtropical areas in South America and Africa, and it is commonly spread by the mosquitoes that belong to species of Aedes aegypti. The evolutionary origins of the virus indicates that it may have originated in Africa, and it was transmitted from primates to humans. Because the virus was found regularly in Africa, the natives have somehow developed an immunity towards it. It was transferred to America during the importation of slaves from Africa. The first definitive outbreak was in the island of Barbados. People first called it zykic, or blood vomit. In 1685, Brazil suffered their first epidemic in Recife. Then several outbreaks began in the Americas, where New York and Philadelphia were most significant. Serious ones were also found in Chile, Cuba, and Southern Europe. The earliest mention of the disease was in 1744 by Dr. John Michloff in Virginia. Geographical distribution. The vast majority of cases take place in sub-Saharan Africa. 32 African countries are now considered at risk of yellow fever. Yellow fever is also considered endemic in 10 South and Central American countries and in several Caribbean islands. It is in the 18th century and the 19th century yellow fever was seen as one of the most dangerous infectious diseases. The disease infects about 200,000 people, which results in 30,000 deaths annually. The yellow fever virus is an RNA virus belonging to the genus Flavivirus. This genus includes the West Nile virus, dengue virus, and several other viruses which may cause encephalitis. The virus is classified as a group B arbovirus, which infects both mammals and humans. Depending on the location, if in forest areas, main reservoirs are monkeys and forest mosquitoes, while in urban areas, people are the main reservoirs. Transmission. The virus is transferred through humans by the bite of an infected female Aedes or Haemogogus species of mosquitoes. Mosquitoes acquire the virus by feeding on infected primates and then can transmit the virus to other primates, but it can't be transmitted from human to human. Humans infected with yellow fever disease are infectious to mosquitoes shortly before the onset of fever and for 3 to 5 days after onset. Yellow fever has 3 transmission cycles: jungle sylvatic cycle, intermediate savanna cycle, and the urban cycle. The jungle sylvatic cycle involves transmission of the virus between non-human primates and mosquitoes found in the forest. The virus is transmitted by mosquitoes from monkeys to humans that are visiting or working in the jungle. In Africa, an intermediate savanna cycle exists that involves the transmission of virus from mosquitoes to humans living or working in jungle border areas. In this cycle, the virus can be transmitted from monkeys to humans or from human to human via mosquitoes. Finally, the urban cycle involves transmission of the virus between human and urban mosquitoes, primarily Aedes aegypti. The virus is usually brought to the urban setting by humans who were infected in jungle or savanna. Life cycle. After transmission of the virus from mosquito, the virus replicates in the lymph nodes and infects dendritic cells in particular. From there, they reach the liver and infect hepatocytes, which leads to eosinophilic degradation of these cells and to release cytokines. Diagnosis. Yellow fever is a clinical diagnosis which often relies on the whereabouts of the diseased person during the incubation time. If yellow fever is suspected, the virus cannot be confirmed until 6 to 10 days after the illness. A direct confirmation can be obtained by reverse transcription polymerase chain reaction, where the genome of the virus is amplified. Another direct approach is the isolation of the virus and its growth in cell culture using blood plasma. Serologically, an enzyme-linked immunosorbent assay during the acute phase of the disease using specific immunoglobulin M against yellow fever or increase in specific immunoglobulin G can confirm yellow fever. Together with clinical symptoms, the detection of immunoglobulin M or a fourfold increase in immunoglobulin G is considered sufficient indication for yellow fever. Liver biopsy can verify inflammation and necrosis of hepatocytes and detect viral antigens. Because of the bleeding tendency of yellow fever patients, a biopsy is only advisable post-mortem to confirm the cause of death. Treatment. No specific treatment have been found to benefit patients with yellow fever. Whenever possible, yellow fever patients should be hospitalized, for supportive care and close observation. Treatment is symptomatic. Rest, fluids, and use of pain relievers and medication to reduce fever may relieve symptoms of aching and fever. Care should be taken to avoid certain medications such as aspirin or other non-steroidal anti-inflammatory drugs, example, ibuprofen, naproxen, which may increase the risk of bleeding. Yellow fever patients should be protected from further mosquito exposure, staying indoors and or under a mosquito net during the first few days of illness. This way, yellow fever virus in their bloodstream will be unavailable to other uninfected mosquitoes, thus breaking the transmission cycle and reducing risk to the persons around them. Symptoms. The majority of people infected with the yellow fever virus have no illness or only mild illness. In people who develop symptoms, the incubation period is typically 3 to 6 days. The initial symptoms include sudden onset of fever, chills, severe headache, back pain, general body aches, nausea, and vomiting, fatigue, and weakness. Most people improve after the initial presentation. After a brief remission of hours to a day, roughly 15% of cases progress to develop a more severe form of the disease. The severe form is categorized by high fever, jaundice, bleeding, and eventually shock and failure of multiple organs. Prevention of yellow fever. Avoid mosquito bites using insect repellent such as DEET. Wear proper clothing to reduce mosquito bites when weather permits. Wear long sleeves, long pants, and socks when outdoors. Be aware of peak mosquito bites. The peak biting times for many mosquito species is dusk to dawn. However, Aedes aegypti, one of the mosquitoes that transmits yellow fever virus, feeds during the daytime. Thank you so much for watching. Please check the sources for more information. Thank you.